Histoplasmosis or the Darling's disease is an infection of reticular endothelial system cells. The Histoplasmosis capsulatum is the dimorphic fungi causes this disease. So the histoplasmosis is again divided into two types. One is a classical histoplasmosis, another is the African histoplasmosis. In the classical, lungs and the reticular endothelial system are involved. In the African, skin, subcutaneous and the bone are involved. Coming to diagnosis, specimen is collected from the lymph node biopsy or the lesion scraping. That means you scrap from the lesions on the skin. You can see it under the microscope using Gemsa stain. So the dimorphic fungi, Histoplasmosis capsulatum is a dimorphic fungi, right? So this dimorphic fungi has two forms. One is an yeast form, another is the filamentous form. Coming to the yeast form, it can be grown on blood agar, and under the microscope it looks oval and large. Coming to filamentous form, it can be grown on dextrose agar, and under the microscope you can see this tuberculoid spore, which is only specific to this histoplasmosis. You can see tuberculoid spore in case of filamentous form, which is a diagnostic form for the disease. In the first one, you can see classical histoplasmosis. The person is inhaling the fungus from the soil and the fungus is going into the lungs. So we have said, right, classical is involvement of lung and reticular endothelial system. So the lungs are involved here, so it's a classical histoplasmosis. In the second picture, you can see multiple skin lesions, right? So in case of skin lesions, the skins are involved in case of African histoplasmosis. So this is about histoplasmosis. Coming to culture, it is gold standard. So at 25 degrees Celsius, you can see tuberculate macroconidia or the microconidia. And at 37 degrees Celsius, you can see yeast forming creamy white colonies. The treatment is itraconazole, amphotericin B, because it is an antifungal drugs, right? Basically, it is caused by the fungus histoplasmosis. So you give antifungal drugs. So this is the tuberculoid spore I was talking about. This is a diagnostic form in case of histoplasmosis. You can remember this by the mnemonic Darling's disease. Basically, there is a web series on Netflix called as Darling's, right? So in that web series, the two main leads are the mom and the daughter. The number 2 is important here. So Histoplasmosis capsulatum is a dimorphic fungi. That means two forms, yeast and the filamentous form. And also the histoplasmosis disease is of two types. So you can correlate that, right? This is about histoplasmosis.